So we previously covered the axial skeleton, and now we're going to take a look at the appendicular skeleton, which is basically all of the bones that allow you to move your arms and your legs. Now, I did actually mention the clavicle earlier just because it was articulating with the sternum, so I did mention that bone, but we're going to first focus on the scapula and the Oscoxa right here. So the pectoral girdle is made up of these two bones, the clavicle and the scapula has quite a few features. And then the pelvis right here, or the pelvic girdle, is made up of this Oscoxa. And the Oscoxa actually has some subparts as well that we're going to look at. So here is the scapula. You can take a look at it from the anterior view. You can see there's one large fossa, while from the posterior view, it's easy to identify because of the spine. And then in terms of knowing if it's the left or right, take a look at this portion right here. So the humerus fits in here. This is the ball and socket joint, which goes right there. And so that will let you know if the arm is on this side, then this would be a right scapula. And then if the articulation is on the opposite side, then of course it would be the left scapula. Okay, then moving on to the Oscoxa. So those are the two bones right here that look like huge elephant ears. And then don't forget the sacrum is right here in the back. We already discussed the sacrum. So the Oscoxa is actually three fused bones. They are made up of the ilium, the ischium, and the pubis. And each of those will have their own unique features as well. So we're going to look at those now in 3D. So when looking at the scapula, again, the easiest way to identify it is by that spine. And then you'll notice that it kind of looks like a triangle and that the articular portion is going to be on the lateral side. So let's go ahead and look at those features. So from anterior view, this right here is called the subscapular fossa. So that's where the subscapularis fits. That's a muscle that fits there. We can also take a look at the borders. So we've got what's called the lateral border and the medial border. And then the bottom has the inferior angle and the top has the superior angle. So it does kind of look like a triangle. Then over on this portion, this is called the glenoid cavity. And that is where the articulation is with the humerus. So the humerus, the head of the humerus fits right there. And then there's going to be some ligaments holding everything in place. From the top, you can see that there's these two really large processes. So this process is called the acromion, and this will articulate with the clavicle. The second process is called the coracoid process, not to be confused with coronoid, which we've seen several times. So coracoid is supposed to mean that it kind of looks like the shape of this bird's head. That's where it got its name from. And then if we go over here to the posterior view, we again have that spine, which I mentioned, very, very prominent. And then above and below the spine, we also have some fossas. So below it, we have what's called the infraspinous fossa. The infraspinatus muscle fits in there. And then above it, supraspinous fossa, the supraspinatus fits in there. And the only other things here we have is just the neck. That's pretty typical that we have a neck. And then we have a little bit of a notch right there and a little tubercle right there. And then we do have a superior border. Oh, and there's a notch right here as well. So that's the suprascapular notch. Okay, so that takes care of the scapula. Now let's move down to the pelvis. Oops. So there's some features that are actually easier to see in this view because once we isolate it, it actually separates it into the three subcomponents. But one thing to kind of notice is we know the front of the pelvis is where this articulation happens, and that's called the pubic symphysis. So the pubic symphysis is another place where we have fibrocartilage rather than just regular hyaline cartilage. So that's going to be the pubic bone right there. And then we have the largest hole here in any bone. This really large hole is called the obturator foramen, and a lot of blood vessels and nerves can go through there. Then from the side, we can see that there's these two arches right here. So the first arch is called the greater sciatic notch, and then the second one is called the lesser sciatic notch. So when trying to isolate the bone, the Oscoxa, it's actually going to isolate it as either the ilium, the ischium, or the pubis. So we can zoom in on those guys individually, but just kind of as a quick overview of how they're all connected to each other. So let's take a look at that ilium. One of the most prominent features of the ilium is what's called the iliac crest right here at the top. It's actually something you can palpate along your hip bone. You can palpate that depending on, how much tissue is surrounding it. And then from the anterior view here, you can see there's two little things sticking out, while in the posterior, there's also two little things sticking out. So we have to really name those quite specifically. So this would be the anterior superior iliac spine. Below it is the anterior inferior iliac spine. And then from the back, we have the posterior superior iliac spine and the posterior inferior iliac spine. Then right here, we have the beginnings of that sciatic notch that I was mentioning, but it does continue down. Right here, we have the auricular surface, which is where the joint is with the sacrum. And then this large portion here would just be called the iliac fossa. And that takes care of all of the important features that you need to know. Then moving on to this portion, the pubis. So probably the most important part would just be the front, the pubic crest. I mentioned that there's that obturator foramen there. And then there's a bunch of other regions that you can name. For example, this is called the inferior ramus, and this is called the superior ramus. But we don't really get into that much detail for that portion of the bone. Then down here for the ischium, this is the portion of the pelvis you actually sit on. So this right here, the ischial tuberosity or ischial tuberosity, is the portion that kind of touches your seat. Then this portion right here is also called the ramus. This is called the body. And then all three of the bones have a portion right here. They just have one piece of it. It's going to be what's called the acetabulum. So if I go back to when it's all together, what you can do here is you can see that the hip bone is connected there, right? So this is the femur. And there's actually a cavity there that the ball and socket joint goes into. So the head of the femur articulates with the portion called the acetabulum. So I've removed some of those bones and ligaments for you so that you could get a better view, but there's the acetabulum right there.